guys, it's Khaki. Had a lot of requests for another What I Eat in a Day video. So I'm gonna do that. It's early, so I need coffee. I drink my coffee black, so I don't have to worry about any kind of creamer or any kind of calories in it. Also, every morning, I have one of these calcium dark chocolate little bars from ProCare. It is wonderful with my coffee, and it counts as one of my calcium supplements. So that's how my day starts. So I am taking my first supplements of the day. I have, well, it's supplements and medicine. I have an omeprazole, a probiotic, and a Linzess, which is something that I'm prescribed for constipation. As many of you know, after a bariatric surgery, that's something we struggle with. I always have people ask, why are you taking omeprazole? I thought gastric bypass cured acid reflux. Did you have acid reflux before? I did not. And I really don't have acid reflux now. But I drink an enormous amount of coffee. It's my vice. And if I don't take omeprazole, I do have acid reflux. Plus, we are at a higher risk for an ulcer with corrosive agents like coffee. So I take omeprazole to not have any problems. For breakfast this morning, I got these on sale. They're normally very expensive, but I like them and they were on sale this week. The mushroom and Asiago egg bites. These were on sale at Walmart for like $2.40. I'm sorry, at Kroger for like $2.49. So good, inexpensive, quick breakfast, and I did quick this morning. The macros on these, they have 290 calories and I think 18 grams of protein, and they are yummy and easy. A minute in the microwave and I am out for the day. Time for a snack. It's about 10:30. I'm having my first official water of the day. I had my water bottle full when I woke up from water last night. This is the Sonic Cherry Limeade mix-in. Also having a half of one of these huge apples from Trader Joe's. If you have a Trader Joe's nearby, you need to check this out. These apples, you can see, are huge. They're the Honeycrisp apples. They are $1.29 each. I cut them in half, eat half, dip the other half in some salty water so it doesn't turn brown. Also, Dannon Light and Fit yogurt. I love these yogurts, so it gives me a little bit of protein with my apple. It's lunchtime. So yesterday was Cinco de Mayo, and I got fajitas from the Mexican restaurant delivered. So I divided that up into 3 meals. Normally, I do not eat the rice. I just get the refried beans. But yesterday, they put rice on it. I said roll with it. I divvied it out. It's about a 1/4 cup each of refried beans and rice, and then the fajitas. I'm also having the Trader Joe's chunky guilt-free guacamole. This is made with Greek yogurt. It's very good. Got a little bit better macros than regular guac. And then instead of sour cream, I always use plain non-fat Greek yogurt. That's what I'm having for lunch. It's about 3:15 and I'm ready for my next little meal. I'm having, this is some homemade chicken chili that I made. It's very spicy. I love spicy, but it's very spicy. So what I do to compensate that is to mix in some of my non-fat Greek yogurt, kind of like sour cream, cools it off and adds a little bit more protein to it, but it is very good. I normally have a calcium chew in the afternoon for my second calcium supplement, but I've got a little sweet tooth today, so I'm going to have another of these little dark chocolate calcium bars. Caroline and I are off work, and we are headed home. I stopped and got, this is one of my favorite treats, It is an Italian soda. Basically, it's just a little bit of carbonated water with sugar. This one is all sugar-free, pineapple, mango, and banana with a splash of coconut milk. So carbonated beverages at this point in my journey don't bother me. It's completely up to the individual. Some people it does bother, some it doesn't. But again, that's all sugar-free syrup and just a little carbonated water and that splash of coconut milk, and it is great. I have finished my first container of my first water bottle that I fixed today, and then it was full from last night, and then this. So I anticipate getting in one more bottle of water today, and I will have met my goals. Actually, I've met my goal with this drink, but would like to get that extra in. We will see when I get home what I decide on for dinner. So I'm home. I wanted something a little bit lighter for dinner, so I made myself a salad. I've got some, it's kind of an Asian ginger salad. I've got some edamame, some chilled shrimp, lettuce, a little tomato, red bell pepper, and some shredded carrots and cucumber. And then for dressing, I'm putting some of the Newman's Own sesame ginger dressing on it. I get the 2-pound bags of frozen shrimp at Costco, make easy dinners or snacks. You could do so much with them. For my dinner snack, my little sweet after dinner, I'm going to have, this is something I just discovered the recipe for. It's been around for ages, but I haven't ever made it. It is a fluff made out of sugar-free gelatin mix and Greek yogurt, and you mix it together, let it set, and it has almost a texture of a mousse. I've got a little bit of sugar-free Ready Whip on top. I did drizzle a little bit of sugar-free orange syrup on it because it wasn't quite as orangey as I wanted it to be. Next time I make it, I'm going to change the recipe up a little bit, put a little bit less Greek yogurt to my pudding or my gelatin mix. I'm craving some popcorn, so I popped, this is a 100-calorie bag of popcorn, just a snack size bag, the light. I do spray it with a little bit of olive oil and put some ranch powder on it. This is not something that I ate when I was in the weight loss phase. I don't think that I actually ate popcorn until I was about 18 months post-op, and I spoke to my dietitian about it, and she said, try it, see if it has any effect. If it doesn't sit well with it, you'll have tried it, and you'll know. Does great, so I enjoy my popcorn a few times a week. Got my last medicine of the night. I have a multivitamin. This is a bariatric specific multivitamin. Very important that you use the bariatric specific. Some companies even offer different formulations based on the type of surgery that you've had. This particular one has 45 grams of iron in it. So I find that fits me really well. This one is from ProCare. I have ordered from them. I also like Bariatric Pal. Kind of go with whichever one has the best sales. I do have stool softener and something to help me sleep and an allergy pill. I do have my last water of the day. This is flavored with the skinny syrups. They have come out with a new tea summer line. This is the sweet tea mixed half and half with the lemonade. Very good. My last snack of the day, which is what I have pretty much every night, I have got some protein ranch dip that I make with my Greek yogurt again. You know I love Greek yogurt. And ranch powder. Then I have some vegetables to eat with my dip. I've got some celery, carrots, cucumbers, tomatoes, pickles, red bell peppers. I think overall it was a really good day. Let's go over kind of my macros. I ended up with, let's see here, 1,346 calories today, which is actually a little on the low side for me. I usually am around 1,500 to 1,600. Then I got in 43.3 grams of fat, 116 grams of carbs with 21 grams of fiber. Proud of that. 111.2 grams of protein. So I met all my goals. As I have said throughout the video, I'm in maintenance. I am 2.5 years post-op. Weight loss is not my goal at this point. I have gotten to where I want to be. Now I'm letting my body kind of guide me to maintain it. The reason I make these videos at this point is to kind of show people who were maybe earlier in the process or just thinking about it, what their life will end up like. Everyone's body is different. Your post-op life and my post-op life are probably going to be different. But this is where things are working out for me. This is where things are settling in. I remember when I reached my goal and I went to go see my dietitian, she told me then, I told her I am comfortable where I'm at. I do not want to lose any more weight. She said, up your carbs. So that's what I did. And where I'm landing is pretty much where I land every day in that department. I do have a follow-up in the morning, first thing in the morning, 7:45, with my bariatric surgeon and my bariatric dietitian. So stick around to the end of this video. I'm recording this on a Tuesday night. After I see them, I'll put a little update in to tell you if they made any suggestions or changes. I hope that everyone has a great week, and I hope that seeing this kind of gives you some thoughts as to what life looks like a few years out. Would love to hear where you're at in your journey, any questions that you have, anything that you're struggling with. Always like to hear video suggestions. The reason I did this What I Eat in a Day video is I've had several people say they really enjoy these and get some insight from them. Anything else you want to see, just let me know. Any questions, drop them in the comments. I will see you again next Wednesday. And again, hang around for a second. I will tell you how my visit went. Bye. I had my 2.5-year follow-up today with the bariatric surgery team and then also with the dietitian. My team suggests after that 18-month mark doing a yearly follow-up. At this point, I have continued to do every 6 months just because I feel like I need that connection. After I do my 3-year in December, which my surgery was actually November, but my appointment is in December. I don't know if I'll go to yearly or not. I'll just see how I feel then. But I started off with the dietitian, and we did a recall of my last 2 days of eating, including the day that I did the video on. She said she would not suggest any changes, that she felt like I was doing great. She actually suggested that I probably needed to up my calories a little bit, which I told her that was actually a low day for me. But no changes, no change in anything that she suggested. She thought everything was great. The surgical team also said the same thing. They felt like I was doing good. The thing that I always like to ask, because I'm a healthcare provider, I see everybody, all conditions, all comorbidities. I do see a lot of bariatric surgery patients, but that's all that they see. So I always ask, what is the one commonality that you see, or the one thing that you think contributes most to people getting off track or regaining? The dietitian both times that I have asked her, number one, she has said drinking your calories, whether it is soda that's full of sugar, juice, alcohol, regularly drinking your calories, in her opinion, is the number one thing that leads to regain. The bariatric surgeon said that she felt drinking calories and also people getting below like that 60 gram of protein minimum, because once you get below that, she said, obviously your calories are coming from somewhere, and it's typically not fruits and vegetables. So she said, that's something that she sees in common with people who come back with regain. I did, like I said, feel very good about the report I got today. I think that I am on the right track, and that's what I found out at my 2.5-year follow-up, and then that's what I ate in a day. See everybody next week. Bye.